All right, well, welcome everyone. Thanks for joining us at the end of Pride Month here. Um, we're going to be talking about LGBTQ youth mental health. And I'm here with my colleague, Sarah Doyle. We're both staff clinicians at the Baker Center for Children and Families, the Center for Effective Therapy. Um, Sarah's going to walk us through what we're going to be talking about today. But first, I just want to acknowledge that, these presentations are made possible by grant funding from SAMHSA and the NCTSN. So, yeah, thank you for joining us. And Sarah, take it away.
Great.
Oh, one more thing. If you have any questions, you can put them in the chat. We'll also have some time for questions at the end, so you can message Alex here. Thanks for the wave. You can message Alex privately or just put them in the general chat and he'll be compiling them for our discussion. That's it.
All right. Thanks, Courtney. So again, thanks to everyone for joining us today to talk about this important topic. I'm going to just give a brief overview of what we're going to cover today. So we're going to start with reviewing some important considerations to keep in mind when we're providing care for LGBTQ youth, intersection between an LGBTQ identity and mental health symptoms, barriers that this population faces in accessing care, and then what to look for when you're looking for an inclusive and affirmative provider. And then we're just going to end with talking about what us as professionals can do, as well as other natural supports to ensure future well-being. All right, so I'm going to start with just defining some of the terms we're going to use today. So when we're using the term LGBTQ+, we're referring to an umbrella of sexual and gender identity terms. Specifically in the acronym here, this stands for lesbian, gay, bisexual, transgender, queer, and questioning youth. There are also a number of other identities that are underneath this umbrella, and terminology is always being updated. So generally, it's going to be best to take our cues from the community and individuals in terms of what terms feel best for their own self-identification. In terms of prevalence in the population, last year's census by Gallup found that 9.3% of US adults currently identify as LGBTQ, which is up from 3.5% when this was first gathered in 2012. We also know that LGBTQ identification is increasing in younger generations of Americans, so in the young population that we're talking about today. Another important term for us to keep in mind today is intersectionality. So this is a framework for understanding how multiple types of inequality overlap and can create barriers. So when we're thinking about mental health outcomes for LGBTQ youth, we're thinking about a number of identities and how they interact with each other. So including, but not limited to, someone's sexuality, gender identity, their race, their ethnicity, etc. I'm going to talk first about some of the risk factors when we think about mental health outcomes for LGBTQ youth. So first, discrimination and bullying. We know that LGBTQ students are at a higher rate for being bullied than their cisgender and heterosexual peers. A Trevor Project report completed last year found that 50% of LGBTQ youth that were polled had experienced bullying in the last year. We also know that this population is at a higher risk for harassment, violence. According to FBI hate crime statistics, more than 20% of hate crimes occurred due to an offender's feeling about the victim's sexual orientation. We also know that this population is at higher risk for social rejection and isolation. This could look like a number of things. It could look like microaggression, so using someone's birth name instead of their chosen name, could look like misgendering a trans youth. We also know when youth are not accepted by their families, they experience higher rates of homelessness. So again, that Trevor Project poll from last year found that 28% of LGBTQ youth reported currently or previously experiencing homelessness. And more than 40% of the youth who were polled said that family conflict was a factor in their housing instability. So either they were explicitly kicked out or they had run away or been abandoned due to mistreatment or fear of mistreatment related to their identity. In terms of intersectionality, we also know that LGBTQ youth of color are overrepresented in this area as well. So Native, Indigenous, LGBTQ youth have more than double the odds of experiencing homelessness. Black, Latinx, multiracial LGBTQ youth also have higher rates of homelessness. Lack of access to medical or mental health care is, again, one of our risk factors. We're going to talk about this further on in the slides, but this could look like, current legislation targeting gender affirming care for trans youth. Um, and again, we'll talk more about barriers for accessing mental health care a little bit later on. Another risk factor is LGBTQ youth who go to conversion therapy. So this is a discredited, unscientific approach to change someone's sexual or gender identity. The American Psychological Association has, quote, advised parents, guardians, young people, and their families to avoid sexual orientation change efforts that portray homosexuality as mental illness or developmental disorder, end quote. And we'll talk a little more about conversion therapy later on as well. And then finally, risk factor to keep in mind is just in general the political climate and legislation. Again, that annual LGBTQ mental health survey completed by the Trevor Project found that 90% of LGBTQ youth reported that recent politics have negatively impacted their mental health. All right, so let's talk about some of the protective factors. So these are things we want to be assessing for when we have youth in treatment. These are also things that we want to be building upon and identifying and helping youth develop. So our key protective factor is social support. So think of this as natural supports, friends, family, classmates, teachers, professionals. We know that social support, especially from LGBTQ identifying people, help youth feel less alone. But non-LGBTQ allies can also help increase resiliency and more positive mental health outcomes in this community. Youth who reported higher levels of family acceptance were two-thirds less likely to report suicidal ideation or suicide attempts compared to those with lower family acceptance. Another key social piece is role models. So providing LGBTQ youth with either in person, online, whether it's members of their family, members of the community, could be celebrities, public figures. It's a positive representation of an LGBTQ adult. This can help challenge stereotypes, stigma, and just overall increase positive future outlook and self-esteem. Similarly, visibility in media, especially positive portrayal of LGBTQ youth and adults, especially being able to see themselves reflected as youth in media is important for kids. So this could be in the TV shows, uh, movies that they're watching, music, social media, could also be visibility of trans athletes in sports as well. So, and a supportive environment is also going to be incredibly important. So some examples of what that could look like is inclusive or gender neutral bathrooms, environments where pronoun sharing is normalized. This can be addressed at home, at school, or in the larger community. Could also include protective state or federal legislation. Again, that annual mental health survey by the Trevor Project found that trans youth were able to use their chosen name at home, school, work, or with friends had a 56% decrease in suicidal behavior. So we have a clear link between being supported and accepted with your identity, decreasing those negative mental health outcomes. Could also look like anti-bullying policies at school that have specific protections for LGBTQ identities, as well as schools that have gender and sexuality alliances. So again, that visibility, that access to a supportive community is incredibly important as well. And then, of course, access to mental health care. So we're going to talk again a little later on about barriers to access and how to find a supportive therapist. But we know that accessing mental health care, for everyone, but also for the specifically LGBTQ youth population, can help with lower rates of some of those risk concerns that we have, increases connection and natural supports. It also reinforces help-seeking behaviors. So LGBTQ youth who are in therapy have an increased likelihood to access mental health care in the future.
Thank you, Sarah. So having those protective factors in mind, hold those in mind because some of the things we're going to be talking about more, and we've already mentioned, it's pretty rough. It's a lot that LGBTQ youth are facing and holding. So to just provide a few examples of some of the political stressors that are currently going on that might be impacting LGBTQ youth that um, are a series of executive orders scheduled to be implemented between January of this year and July of this year that are impacting LGBTQ Americans in a number of ways. Although some are already on pause due to some successful legal challenges, or there are legal challenges pending. So, as Sarah said, these news stories about anti-LGBTQ legislation can have a really negative effect on youth mental health. Some examples of this legislation that's currently kind of in the news are changes to inclusive school practices, some of the don't say gay bills and things where schools are being, instructed to not discuss queer identities, trans access to gender affirming care for youth has been in the spotlight. Ability to access and participate in sports that are aligned with their gender identity, changes to gender marker guidelines for federal identification is something that's of concern to the community a lot right now. Changes to policies around housing incarcerated trans folks according with their identified gender, putting folks at risk of harm. Changes to policies related to trans service members and their access to gender affirming medical care. And those are just a few of the topics that are currently swirling around, probably in the awareness of youth. That same Trevor Project survey showed that, the vast majority of trans youth pay close attention to news relating to their community and their rights. And if you're interested, LGBThotline.org has a nice page. They keep updated on the status of those legal challenges and executive orders so that you're kind of able to also stay attuned to the current climate and how it might be impacting the youth that you're working with or in your family that you're trying to support. So one last thing about this, just to the point of risk and protective factors, the same survey data and research shows that news in the media of efforts to challenge these policies, protective legislation that is even potentially being introduced to be voted on, even without it being fully adopted, or other advocacy efforts in the media have a really protective factor on youth and can decrease the impact of some of these. So showing up matters, knowing, I think Mr. Rogers said, when things are hard, his mother told him, look for the helpers, right? And so that really applies significantly. So some of the mental health challenges that, not surprisingly, LGBTQ youth struggle with, given this greater vulnerability to the risk factors Sarah's been going over. Anxiety and depression. I'll just briefly define in case, I know we have some professionals here, but some folks. Anxiety is, broad definition, an emotion characterized by apprehension, somatic symptoms in your body of stress and tension when you anticipate impending danger, catastrophe, misfortune. It's different from appropriate fear and accurately assessing risk. which unfortunately is something that a lot of LGBTQ youth do have to navigate. Anxiety can develop from that kind of consistent exposure to risk where the brain gets rewired to kind of worry, fear, and avoid safe situations as well. So there's a balance of helping youth navigate, okay, what is like a true alarm and I need to be aware and alert to keep myself safe, and where is my anxiety causing unnecessary stress and problems for me. 67% of youth in that Trevor Project National Mental Health Survey from 2023 reported experiencing challenges due to anxiety, and 54% reported challenges related to depression, which is this mood disorder causing persistent feelings of sadness, loss of interest. It can affect your feelings, thoughts, and behaviors and lead to a lot of problems, emotional and even physical. Kind of struggling to do day-to-day activities, even thoughts and feelings of life not being worth living. And so just like anxiety, this is different than normal periods of sadness. It becomes pervasive and kind of a lasting emotional state without treatment. So this is the most common mental health issue in the general population, anxiety and depression, but LGBTQ youth are at increased risk compared to the general population, with that number being even higher for folks with more of those intersecting marginalized or oppressed identities, such as trans folks, people of color, and higher rates for youth in that vulnerable age of like 13 to 17, with some slight improvements as they get older, 18 to 24 range, that starts to dip. Similarly, this population is really vulnerable to trauma. Sarah reviewed a lot of the risk factors, and these sources of potential traumatic stress are things that many youth are more likely to encounter. Not everyone who experiences a traumatically, like a stressful experience, has lasting symptoms of trauma, but depending on your other vulnerabilities, it can make you more vulnerable to continuing with symptoms over time. Trauma can be a discrete, acute event like an assault, but it can also be a series of smaller things that build up over time and lead to a general environment of feeling unsafe, that can kind of skew the body's ability to discern when there is safety. So folks not being supportive of someone coming out, as Sarah mentioned, that family rejection that can occur and have a huge negative impact and lead to other potentially traumatic situations, verbal harassment, bullying, and discrimination, which that 50% number is really significant. And even just secondhand learning about things that are happening to people in your community obviously is going to make you more concerned that you're at risk of those experiences, even if they're not happening to you directly. So another huge concern that Sarah's already mentioned for this community is suicidality. So suicide is currently, in general, one of the leading causes of deaths for teens in the United States. For LGBTQ youth, they're 4 times as likely to actually attempt suicide than heterosexual cisgender peers. And so when we talk about suicidality, we think about suicidal ideation, having thoughts about ending your life, from the passive thoughts of, I don't want to be here anymore, I wish I would never go to sleep and not wake up, to more dangerous progression along that spectrum towards like having a plan, having the intent to carry out that plan, and then eventually making an attempt to act on that plan. And so this 4 times more likely number of folks who get all the way to that end of the spectrum is really concerning. This number gets even higher again with trans youth and youth with other intersecting oppressed identities. 1 in 5 trans and non-binary youth, according to this Trevor Project data, attempted suicide in the past year. So that is a really significant and concerning number compared to 14% of LGBTQ youth in general. Um, so, and then when we break things down by race and ethnicity and the stressors from discrimination experienced on top of queer identities for those youth, 12% of white LGBTQ youth attempted, compared to 21% of Indigenous youth, 19% of Black queer youth, and 16% of Latinx queer youth. So, you know, very challenging to hear, but helpful to keep in mind if you're working with or supporting someone in your life who carries some of those identities. Thankfully, identity is not destiny necessarily, right? The rates vary widely, even within identities, depending on the individual environment, experiences, and support available. Sarah mentioned that dramatic improvement in suicide risk for something as simple as using someone's preferred name and pronouns. So these are things that we can do and advocate for other people in the youth's life to do to really try and protect. Things as simple as access to gender neutral bathrooms, access to gender affirming clothing, can have a significant measurable impact on suicide risk. So another thing youth are more at risk for in the LGBTQ community are eating disorders. According to the National Eating Disorders Association, folks who identified as gay men were 12 times more likely to report purging behaviors. And folks who identified as queer women were 2 times as likely compared to cisgender heterosexual female peers to report binging behaviors. Trans youth can also be vulnerable to body dysmorphia, and that can contribute to risk of eating disorders because of just this focus on trying to make their body feel more like home and make changes that not always in the most adaptive, healthy ways. Finally, substance abuse as a risk factor. Anyone in the population can be at risk of developing a maladaptive habit of coping with substances to escape, pain, anxiety, loneliness, all of these things. But LGBTQ youth, because of the environment and stressors that we've been discussing, is especially vulnerable to turning maybe normal teenage experimentation into an evolving, more impairing practice. So the National Institute on Drug Abuse reports LGBTQ Americans have higher rates of substance abuse and substance use disorders than folks who identify as heterosexual. If this evolves into a more problematic level of misuse, folks can be exposed to increased challenges, including loss of jobs and housing, damage to relationships, physical and sexual violence, again, increased by substance misuse, and STD risk.
Okay, thanks, Courtney. So I'm going to talk now that we've kind of outlined the impact on mental health symptoms, what it looks like when we get to looking for care. So first, just acknowledging some of the barriers that this population faces when accessing therapeutic or other services. The most significant one that was reported by about half of the youth who completed that annual mental health survey by the Trevor Project was just in general access. So affordability of treatment, whether they're able to, cover those copays or if their insurance would cover sessions, as well as ability to actually get to an office, or especially if they're living in more rural areas, just the upfront costs of having to get themselves into the space. Other barriers to care that were highlighted: concerns or fear of being outed. So concerns about kind of the limits of confidentiality, and maybe some misconception that therapists would like unintentionally out them or share their identity with their caregivers, with folks that they weren't ready to be out to yet. Again, related to that caregiver relationship, right? So that rejection, that lack of support, um, knowing that we work with youth, right? We need parental consent to provide services. So I believe it was about 20% of LGBTQ youth reported that they were worried about receiving therapy and concerned that their parents would not consent to services. In general, this population is also concerned about providers who won't get it or won't be able to work with them and acknowledge their lived experience, as well as recognizing that that also is a problem in the field is providers who are not competent or knowledgeable to provide services to the population. And then finally, again, when we're thinking of intersectionality, recognizing that especially in communities of color, there's also potentially an added cultural stigma with receiving therapeutic services in general. So again, this could look like some of the words that youth described when they thought about what it meant to get therapy were that they would feel embarrassed or shamed or weak if they had to ask for help. Um, and also, again, higher concern in LGBTQ youth of color in terms of that their therapist would try to convert or change their sexual or gender identity, or that they would disclose and share their identity without their permission. So when we're looking for inclusive, affirming care, some of the things that, we as providers want to be doing and that if we're helping our youth access care, these are some of the things we want to be on the lookout for. So first and foremost, your therapist should be someone who is going to just help, reduce stigma, dispel stereotypes, provide really good education to you on the intersection of your identity and the mental health symptoms you're experiencing. So, someone who is providing informed care is not just going to be familiar with how to treat your depression or anxiety, but also be keeping in mind, again, the intersectionality piece of how your individual identity and lived experience either can exacerbate some of those symptoms or where those protective factors lie for you. Sometimes youth might also feel more comfortable working with a therapist who identifies as LGBTQ themselves. So many therapists will also self-identify in that way, or they will, put on their website or signal to clients that they specialize in working with this population. So when it comes to culturally competent care, that means us as providers that we're doing our own ongoing training and education, that we're not relying on our clients to have to teach us everything. I'll talk a little bit about inclusive environments as well, but generally that we want to be up to date and knowledgeable about, again, the current risk and protective factors that are affecting this population and making sure that we're bringing that into the therapeutic space um, and considering how it's going to uh, play a role in treatment outcomes. Affirming care with therapy, we know that there's an inherent power dynamic and hierarchy. So again, not having to have our clients educate us on everything about their identity, but also allowing them to be the ones who lead the conversation when it comes to what terms they want to use, what pronouns they're using, also helping them figure out and build up those natural supports. So, where is it safe for them to come out? Where might it not be safe to come out? Where do they feel safe expressing their gender identity? Um, and also that you as a provider should be affirming, supportive, and validating so that you're not bringing in any of your own biases or stigma or discrimination into the therapeutic space. So finally, again, inclusive environments was one of our key protective factors. So that includes and is especially important for the therapeutic space. So that could look like the posters that you have in your office. I know, like at the Baker Center, most of us outside of our office, you're going to see as you walk down the hall, someone has, a pride flag or something like we see on the slide here, noting that all are welcome. So those signposts can be really helpful just for youth to feel seen. Could also look like having your pronouns, whether it's, on a virtual call like this or displayed in your office. Asking really open-ended questions when it comes to your intake forms or assessment. And also using language to say, I'm asking everyone these questions, and the goal is to be really inclusive and make sure I use the terms that feel right for you. And again, that does look like following youth's lead in terms of, who you should use their pronouns in front of. Again, not trying to out any of them without their permission. Oh, Courtney, I think you're muted.
Thank you. Thanks, Sarah. Um, a little more about conversion therapy, because it has been historically and currently a source of such harm to LGBTQ youth mental health. Um, you know, Conversion therapy can really be defined as, according to the American Academy of Child and Adolescent Psychiatry, they describe it as any so-called like therapeutic intervention operating under the premise that a specific sexual orientation, gender identity, or gender expression is pathological. So treating it as a disease rather than what we've been building here today, which is this understanding that it is simply an identity that the societal response and environment um, adds challenges to holding. So, as Sarah said, this has been completely discredited. There's a strong body of research on the significant harm that it's done, and no evidence that it is possible to even change gender identity or sexual orientation. Um, the role of therapy for queer youth should really be about, supporting youth who may be feeling uncertain about their identity or confused or distressed, or maybe even wishing that they were not feeling queer, right? Supporting them to understand and express their identity and explore it and clarify that for themselves in a safe place, rather than trying to influence where they land on that decision in any way. So because of all of this strong evidence of how harmful it is, many states and cities have laws protecting youth from these programs. And that, you know, the majority of youth, surveyed in this Trevor Project said that it significantly improved their mental health when their local area, or even hearing about in another state, laws being passed to ban these methods. So even if it feels like that's not something that youth that are dealing with, the mere existence of it being out there and part of the conversation can do harm to mental health. And about 13% of the youth in the Trevor Project 2023 survey reported undergoing conversion therapy in the past year. Most of whom, up to like 85%, were under the age of 18. So that's a very vulnerable time for youth who are already doing a lot of identity development work to be subjected to something so harmful. So what can caregivers do? We've been talking a lot. I can imagine if you're a caregiver listening to this right now, it's been a lot of scary stuff. And luckily, caregivers can have an incredibly powerful role in reducing the risk of harm to your LGBTQ youth. So it's all about reducing the risk factors and increasing the protective factors. Simply said, the best way to support your child is by having their back, making sure your home is a safe, supportive place. Sometimes really well-intentioned caregivers who are afraid of how the world will respond to their child will have this instinct to protect them from bullying, protect them from those outside responses by encouraging them to suppress, tone down, or hide elements of their identity. And, while understanding this is coming from a protected place, it can have the opposite impact as intended. It can leave youth to feel unaccepted at home and even more alone. So a more effective approach, if you're worried about your child experiencing bullying or discrimination or even violence, based on how they are dressing or behaving or sharing their identity with folks, is to just make it clear that you support them, you're on their team, help them problem solve around how to stay safe and cope with the reactions of others. Acknowledging you can't necessarily control how others treat them, and but merely seeing you stand up for them can really reduce the negative impact of those experiences, right? You might want to help them just skip the battle, but since that's not healthy, like that leads to a different battle of kind of that isolation and loneliness. Instead, go to battle with them, right? They're much more likely to get through less harmed if they have a team behind them. So an example of this might be if a child who is assigned male at birth wants to wear nail polish or a skirt to school. Some parents might have the instinct to say, oh, no, you can't do that because, I don't want people to tease you, right? But a more helpful approach might be helping them be aware that some people might be confused and not understand that it's totally okay, that anyone can wear skirts and anyone can do nail polish. And so they might say like silly things, hurtful things. And that's because that person is confused, right? That would be a way to not stop those comments, but lessen how much they hurt. Standing up for your kid at school, right? Again, we can't always control these other environments, but even your child seeing you try to stand up and advocate for them can be really protective. Making sure that their health providers are affirming in the ways that Sarah outlined. Giving access, sitting down to watch a show together about a queer youth, and having them see that you approve of that as well, that you're interested in their community. Going to events together and joining support groups. If you're advocating for your child, it can be an uphill battle, and having other people who are doing the same thing can be helpful for you, connect you to lots of resources. And you want to make those resources available to your child as well. They might not tell you everything. A lot of the research shows kids come out to friends long before family members. And so if they're struggling alone with something, whether or not you think your child might be queer identified or not, sharing some crisis resources with them in advance makes sure that they have at least someone they can talk to at whatever stage of coming out they're at. So another just note is that there's a big conversation right now in parenting and child mental health around screen time. And screens are a big contributor, according to the research in a lot of ways, contributing to the youth mental health crisis. One exception here is that for a lot of queer youth, especially in rural areas or communities where they don't have access to in-person queer community, online communities can be a source of really huge, important support. So just being mindful of that when you're thinking of how to manage your teen's screen time, that there might be some life-saving connections that they're having online that you want to maintain accessibility for them. On the flip side, online harassment is a thing. So just trying to be as open and talking to your kid about what are they doing online to see if it's helpful or contributing, making them vulnerable to exposing them to more harm. So lastly, here are some crisis resources that are specifically geared towards LGBTQ youth. The Trevor Project is one we've been citing all day today. They are a great resource, a hotline resource. The LGBTQ plus national hotline, the National Coming Out Support Hotline, and there's the National Youth Talk Line, which is actually peer-to-peer, and the Trans Lifeline specifically for trans teens. The National 988 Mental Health Crisis Hotline used to have a specific offshoot to ensure culturally competent responses for LGBTQ youth in mental health crisis. 1 week ago, an executive order ended funding for this specific offshoot due to the view, according to Health and Human Services, that it promotes radical gender ideology. So, that's another example of some of the changes and supports that are um, currently in flux. That offshoot has been in place since Congress passed some legislation in 2020 that required that lifeline to specifically provide those specialized LGBTQ services and other protected groups like Native Americans. So that's a significant change. That might not be a first choice because you're not necessarily insured now that you're going to get a culturally competent provider on the other end of the line. That brings us to the end of our presentation and into the questions. Alex or folks, what are folks wondering about?
I don't see any in the chat and I didn't get any DMs. So I guess we can just open it up for folks. If people want to come off of mute, you can feel free.
Yes, copies of this recording are posted to our YouTube channel. And so if you go there, you'll find many more presentations on other topics as well. Let's say you're worried about depression for a trans youth in your life. There's a whole presentation specific where you can learn more about depression or anxiety and other specified topics and forms of effective evidence-based treatment. So this will join that library there. We also have there's a topic of the month each month, and so for every monthly topic, there's a recorded YouTube presentation, a blog post summarizing a lot of the same information on our website. Yes, thank you, Alex. There's the blogs, so you can look for things there in different formats. Let's see from Bethany, any advice on opening up the opportunity for conversations around the topic of identity if you just think a youth may identify as LGBTQ but isn't out? I think, some things Sarah mentioned about like supportive environments, there's lots of signaling you can do that you might be a safe person to have that conversation with. Whether it's like just putting a pronoun pin on your bag and, saying happy Pride Month to folks, whether or not they may be LGBTQ. Lots of little ways that you can indicate that, even just sharing your own pronouns, making it clear that you're down with things, you're up to date, you're accepting. But there's so many reasons besides fear of like direct rejection that someone might not be ready to come out. It can be really confusing, and maybe they're needing time to understand before sharing it with you, or maybe they want to work it out with you. But yeah, I think just being attuned to that youth that and like I said, you can also just give them resources in general in the meantime, right? Maybe you give them some crisis resources that are for the general population, and you tag the Trevor Project in there as well and say what it is, right? I don't know, Sarah, any other thoughts?
Yeah, I think using again like inclusive language when you're talking with, your client, your youth, right? When you're discussing you know, talking about like romantic interests, right? Like using gender neutral terms, I think can be helpful too, just to like not assume or kind of ask and put someone in the corner, I think is also a helpful way to do it.
Yeah. Are you dating anybody? Rather than, you must be a lady killer, right? Like, that's probably going to shut things down. That's wonderful, Amy, that you're contributing to the safe environment in your neighborhood with your flag. How to intervene in anti-LGBTQ teasing amongst boys. Yeah, it can be tricky, especially depending on the age, right? Like a middle school boy versus someone who has a little bit more critical thinking and further development. Um, Even I think, what we were talking about of making sure that folks know that you take it seriously, even if you're worried it won't be completely effective to make those other boys stop doing that, um, to say something, that youth who's being targeted will see you say something. And, that will have an incredibly protective impact, knowing that every adult in my life is not co-signing this behavior, right? And so then maybe having a conversation with that youth afterwards about how, similarly to the example I gave about the nail polish, right? Wow, those boys are so confused. They don't understand how cool it is to be yourself, right? They don't understand how, I mean, you can get into how imprisoned they are by the cage of their own traditional masculinity, and you're free. They're gonna have to take some time to figure this out. Wow, they don't think they can cry in front of each other. That's so sad. Like, so you can try to connect and support them in that way. Um, yeah, schools have different like programming they try to do to address this in a more preventative way. But yeah, even just a small like in the moment comment of like, there's nothing wrong with what they're wearing, or you know why would you, yeah, like, we don't talk about people in that way. I don't know, I can't think of an example in the moment, but just something where you're making it clear you disagree, you don't find what they're saying is acceptable, um, and then offering some additional support afterwards.
Thank you.
Yeah. Oh, in Oklahoma. Okay, Amy. Yeah, I don't know. I've never been to Oklahoma and I don't want to go based on stereotypes, but maybe making a more of a statement than here in Boston if we were flying a flag. Yeah. Yeah, just to reiterate, especially if you're in a space where youth rightly assess that most people might not be safe people on this topic, the impact of having even one person be clearly a safe person can just, when you think about the constant stress and vigilance and fear that someone might be experiencing in every different aspect of their life and environment, if they can go to that teacher's classroom during lunch and sit somewhere for 30 minutes and let their shoulders down and know that in this room they're accepted, that there's one person out there that thinks it's okay to be who they are, that is still huge. And so, whether you're a therapist or a parent or a teacher, don't underestimate the impact of that. Yeah, Amy. Okay, that was your experience. It sounds like, or maybe having had one. Yeah.
I just know that it would have made a huge difference looking back and then seeing kind of the queer youth in Oklahoma right now and knowing, you're talking about the anxiety and the depression and all this, and I see it in real time. And just knowing that they have people in their lives that are showing up and doing the work, even when it's not easy, I know it makes a huge difference for them.
Mm-hmm.
Um, so, yeah.
Any other questions in our last few minutes here? I guess one last thing that I'll just share, kind of relating to suicide, is that's obviously a really primary concern General advice when talking to youth about suicide is don't be afraid to talk about it, right? Some people worry that if they ask the question, they'll put ideas in someone's head, or they avoid it because it's just so uncomfortable to talk about. But I promise you, if someone is not thinking about suicide and you ask them about it, they're not going to suddenly become suicidal. But if someone is, knowing that someone is brave enough and cares enough about them to be uncomfortable and say, hey, you know, I noticed you've been down. Do you ever have thoughts about killing yourself? Right? Just even that blunt, that's okay. And that gives them the chance to, even if they deny it, know that that's something that you're okay to talk about. And maybe they might come back to you and seek your support.
Okay, well, I guess if there's no other questions, we can wrap it up there for today. Again, I think Alex put the links to where you can find the recording for this talk today and blog post associated with our topic. So again, thank you so much for joining.